11:05 on your Saturday morning. Good morning to everyone out there, and thank you for making us part of your day. This is the PinPoint Health Show, but I'm not John. Dr. Lou is here. I'm Chris Creston, filling in for John Scholes, who had to jump out early today. So I appreciate you bearing with me because I don't know the subject matter as much as John does. But,
no, that's okay.
This show I've always been interested in, and I'm always interested in just sort of pain and health and all those topics.
Awesome.
And I'm really glad to be sitting here across from Dr. Lou.
We are happy to have you. And we were just talking before we came on air. It's because John's been doing it so long with me, he's almost like an expert himself, right? So I see him like he'll sit there and he's just nodding and you could tell he's thinking like, yeah, I already know that. So this is nice. So, it's great to have that interaction because I'm sure I'll talk about things that maybe you're just wondering. So I love that candid conversation. But thank you for being here, for helping us out when John couldn't be here.
Terrific. I just want to throw out the phone numbers here, 416-870-6400, star 640 on your cell phone. If you've got a question for Dr. Lou, you want to talk to something that is happening in your health and in your life that you want Dr. Lou to help you with, and you're hoping to get a little bit more knowledge on, and maybe want to get some preliminary chat with before going in to see him live and in person. And that's 416-870-6400, star 640 on your cell phone. How's your week been, Doctor?
It's been good. Busy, a very busy week, actually. But that's okay. One of the things that I typically will start with is sort of like the week that was and things that were happening. And one thing that I don't talk a heck of a lot about on the show, we have a division of our business where we actually do what are called independent medical assessments. These assessments are essentially a lot of the times for things like car accidents or hurt at work type of things, slips and falls. Essentially what they are is when someone's involved with something like that and there's a litigation process that's going on where lawyers are trying to, whatever. We're not on the lawyer side. We are not the lawyers, but we work both on the defense and actually the plaintiff, right? In terms of our assessors. The whole idea with being an independent assessor is that you should be impartial.
Right.
And that you shouldn't be biased to one side. In fact, most experts that are now brought on stand, if it's not the cross-examining lawyer, the judge will ask, how much of this type of work do you do for the other side? And so we've tried to diversify. And when I say we, I mean me and the group of physicians that we have doing this type of stuff. We work on both sides. So we do defense-based work and we also do plaintiff-based work. And really our job is to provide an impartial examination on this person's injuries or comment on disability. There's a lot of things that we get commented on. The one thing that I wanted to bring up, and this is specifically for the people on the plaintiff side, so the people who have lawyers and you're actually involved in something, because the insurance chooses who they want, right? You can't really do anything about that. That's just sort of the way insurance companies work. They're big companies, etc. On your side, on the side with your lawyer, you can actually have a say on who you'd like doing these assessments for you. Because the lawyers, it's a more of a one-on-one relationship. You're dealing with your lawyer. Your lawyer will be the person that contacts some type of specialist depending on what the problem is, right? Like if there's a neurological issue, then it would be a neurologist. If there's a psychiatric issue, it would be a psychiatrist or a psychologist. So that all very much depends. And typically the lawyers will have a roster of physicians that they work with as well. But what I wanted to bring up for people who are potentially listening that have been hurt in a car accident or something like that, or in the middle of this litigation process, is one of the most important things on that side is getting as good, if not the best possible type of expert to do your assessment. And, over the years, we've built quite the roster of professionals who deal with this type of stuff. And we are very, very picky in terms of who we use for these things. So we're not. We number one want to make sure that whatever expert we're using is. Oh, I thought the music was going on. That the expert is well versed in, obviously, an expert in what they do. We like when they're affiliated with teaching hospitals. We like when they still maintain a practice. This is a big thing. There's a lot of people that do this type of work, but that's all they do, right? And so from a purely biased perspective, you can think, well, if that's the only way you make money, well, then that's sort of biased towards the opinions that you might give. We really try to choose people that have more than 50 or 60% of their time is actually dedicated to care. So there's examples of orthopedic surgeons out there that do this type of work, and that's all they do. They haven't performed a surgery in years. Our orthopedic surgeons are orthopedic surgeons performing surgeries every week. And once in a while, we provide these types of things. So I think the quality of expert that you have is very, very important. And the reason why I bring it up, because this show is all about educating the public. If you are involved in these types of things, you have a say with your lawyer on who you could potentially use. And I mean, if you've been listening to my show for years, you trust me. It's just an extension of me and my personality and the things that we've built. The professionals that we bring together on this are some of the best. But I think we have to take a break, and we can definitely keep chatting about that.
We'll keep talking about that, as well as many other things to do with your health and with pain, coming up on the other side of the break here. If you want to give us a call live on the air, that number is 416-870-6400, star 640 on your cell phone. That's why Dr. Lou is here, to take your questions live on the air. 416-870-6400, star 640 on your cell phone. PinPointHealth.ca, info at PinPointHealth.ca. More of Pinpoint Health with Dr. Lou on the other side of the break here. Global News Radio, 640 Toronto. 11:16 here, pinpointhealth.ca, info at pinpointhealth.ca, and you can always call 1-855-55 Lou to get a hold of Dr. Lou off the air. That's 1-855-55 Dr. Lou. We're going to take a call on the air just in a second. I just had to ask one question. We were talking about those independent medical assessments that you do, Dr. Lou, and I wanted to know how people get a hold of you to do that.
Yeah, so it's simple. If you've been hurt in a car accident or anything like that, give me a call. We would probably schedule a conference call with your lawyer to see what type of assessment is best. Like when we say independent medical assessments, that's a broad term. Mm-hmm. There's so many different. Sometimes it's a matter of functional capacity evaluations. Sometimes it's specific specialty assessments. Sometimes we do what are called multi-assessments, where you're actually getting 3 or 4 professionals together to comment on an opinion. But these things are essentially done in order to legitimize your claim, right? That's the reason why they're being done, is in a way to determine, okay, is there actually something here? Because you can imagine in litigation, and again, we work on both sides, so I see it. The insurers always want to, essentially their biggest objective is to make sure that, or to try to prove that nothing is actually wrong. And even on the lawyer side, it's biased. They're always trying to prove that something is wrong. And the only way to really come, and we understand that, and the only way to really determine, okay, well, what's the truth here, is what these independent medical examinations are for. And they'll typically, if one is ordered by the insurer, one will also be ordered by the plaintiff. Because again, now it goes even deeper, where it's like, well, wait, that's your expert and not necessarily ours. But I truly think that the team that we've put together is absolutely incredible. I don't actually do them. Like, I don't comment on these things. It's actually different specialists that we have that comment on these things. But again, if you've been hurt in something like a car accident or in the middle of a litigation process, and this has come up, where in terms of assessments, the most important thing here is you want to have the best quality expert. And this is even for any lawyers listening that are doing this type of work. It would be worthwhile to have a conversation and give me a call, because the team of experts that we have can definitely help build a case for people that unfortunately have been involved in these types of unfortunate events.
Independent and legit professionals who can give their
unbiased. Yes, exactly.
Terrific. Now, I do want to get to a call here. Mike in Toronto has been waiting patiently on hold. Thank you so much, Mike, for giving us a call. What's your question for Dr. Lou?
Hey, good morning, Dr. Lou.
Hey, Mike. Good, you?
Good, thank you. First-time caller.
Thank you.
This isn't necessarily related to, an automobile accident.
No, that's okay. Yeah, that's just sort of a topic that we started with, but I'm happy to help with anything.
Oh, great. Thank you. So I tore my hamstring.
Okay.
It's a nagging, ongoing injury.
Right.
I've been to physiotherapy. I've been to massage. I've been to acupuncture. I've been to osteopathy. And I'm just curious, every single one of those will work for a limited amount of time. Like, a little while it'll feel okay. Nothing's really helped me heal the injury itself. So I'm wondering what specialist I should be, focusing in on.
Right. So let's start right from the beginning. You're sure that you tore it? Like there's actually, like you've had that diagnosed by ultrasound, or there's a visible bulge or defect, as we would call it?
Yes.
Yeah. Okay. So here's the thing with that type of injury, right? There's a difference between sprain strain, where you just maybe where the actual muscle or the tendons or the ligaments actually stay intact, but there's an injury to them. In your instance, when you actually tear something, once you tear it, it's gone, right? And when you look at the hamstring muscle and you realize how big it is, you wouldn't have tore the whole thing, because that would be an absolute medical emergency and almost impossible. Exactly. You probably tore a chunk of it. The thing about that is all of those passive interventions that you mentioned, like I guess what you're looking for is pain relief. Am I right to assume that?
Well, I'd love to be able to continue, being active and playing sports. So due to the tear or partial tear, it now will strain easily. So
right, gotcha.
I'll do something and it'll aggravate it.
So a lot of the time, so two things come to mind quickly. Number one is anytime if you look at a bulk of tissue like a muscle and you lose a little bit of that tissue for something like this due to a tear, you essentially almost have to build up the rest of it to be that much stronger, right? That's one option, which is big on the rehabilitation, the exercise component. The other component, which is harder depending on how long this has been going on, is actually having that reattach potentially. And it sort of depends what tore, what didn't tear. You can't always reattach things. Something as big as the hamstring, because of how big it is, you can go on with partial tears, but it really just becomes that you essentially have to make whatever is left of that hamstring that much stronger to take on the brunt of that. The other reality sometimes is, depending on how much is torn and how much strength you can compensate and get back, or even go above and beyond, it may never be the same either, right? That's the other thing. But I'd have to assess it. It sounds like you're interested in getting an opinion on it. I would have to see it. We'd also probably have one of our sports medicine docs look at it. He's also a surgeon, and maybe there's something that can be done, but I'd have to take a closer look.
Oh, I appreciate that.
Yep. Give us a call.
Awesome. Thanks a lot for calling us, Mike. And that number to call Dr. Lou directly is 1-855-55 Dr. Lou. That's 1-855-55 Dr. Lou, and you can always email him info@pinpointhealth.ca to get that assessment done. Mike, whole lot more of your calls and more with Dr. Lou on the other side. This is Pinpoint Health on Global News Radio 640 Toronto. Good Saturday morning to you. It is 11:25 on Global News Radio 640 Toronto. This is the Pinpoint Health Show. I am Chris Creston, sitting in for John Scholes, and Dr. Lou is here. Otherwise, we wouldn't even do it. Like it's for Dr. Lou. Like, you don't want to sit here and listen to me. I don't have anything
you might be
worthwhile to say.
You might be able to figure it out. Who knows?
No, you don't want my diagnosis on anything. Amputation. Bad call. Don't listen to me.
Yeah, we're not sending anybody to Chris. Everything's an amputation.
Mad scientist Creston over
exactly.
here. So we are taking your calls live on the air at 416-870-6400, star 640 on your cell phone, and you can always reach out to Dr. Lou, info@pinpointhealth.ca. Let's go to Daniel, who's calling us from Bolton. Daniel, what is your question
Where
for
I
Dr.
live.
Lou?
That's awesome.
Beautiful. You got your neighbors calling.
Yeah, there you go. That's awesome. Hey, Daniel.
Hey, Dr. Lou. How are you doing today?
Good. You?
I'm doing well. First-time caller, but long-time listener, and I appreciate you taking my phone call.
No problem.
Just had a question that I wanted to ask you. Many years ago, it's actually a multi-part question. Many years ago, I was in a motor vehicle accident, and I tend to suffer from tension headaches.
Okay.
And I don't know if it's directly related to the actual accident, but I did not seek any medical either treatment or go see a medical professional related to the motor vehicle accident. So I wanted to ask you, is there like a limitation period in the event that I wanted to take? I know that's more of a legal question, but if I wanted to take any legal action.
Yeah. I believe there is a statute of limitations. I think it's 2 years, but that is a legal question.
Okay.
And I'm not 100% sure, but I can find that answer out.
Okay, so
yeah,
we're well past that. The other thing is that I do suffer from tension headaches, and I don't know if it's a direct result of this accident. But what are some things that I guess attribute to the tension headaches?
Yeah.
And then maybe what are some remedies, maybe some things that I can either do at home or on my own? And in addition to that, what are some medical professionals that, I should probably see as well?
Okay. Yeah, good question. So, I mean, the first thing to look at is headache in general, which is a very broad class of problem. And tension or cervicogenic headaches are a subclass of headaches. So you probably heard of migraines, cluster headaches. You can have headaches due to brain tumors, for example. We call those pathological headaches. So there's a lot of things that can cause these headaches. When it comes down to the tension cervicogenic based ones, it's essentially related to the mechanical structure of the neck, the upper back, and a lot of it has to simply do with posture. So anybody in a car a lot or sitting a lot, where you have that rounded presentation, like we all know what I'm talking about. You're sitting at a computer, your shoulders are rounded, your head's down. Yeah, exactly. That type of stuff is the reason why they're called tension headaches is because there's tension on those muscles. So a lot of the muscles in your upper back and neck actually attach to the base of your skull. And so when there's tension there's that pulling effect, the tension gets created, it creates pain. And these types of headaches are often people will complain about them in the back of the head. Sometimes there's a radiation of the pain just above the eyebrow area because of some of the nerves that sort of come out from that area go there. They're often not associated with other things like aura symptoms, like with migraines, where you get photosensitivity or photophobia, which means problems like with light or smells or weird things like that, which is a totally different monster. So those tension headaches, again, are most often due to musculature. We also sort of group them in with what are called cervicogenic, cervical meaning the cervical spine, the neck, and genic to mean genesis. So it's originating from the neck. And so the types of professionals that deal well, this is where the physical manual professionals like physiotherapists, chiropractors, massage therapists, osteopaths are very good at dealing these types of things. The other thing that I'll say is a lot of times this tension type headache is due again to that posture related problem. You can get all of the treatment in the world, but the minute you go back and you have that poor posture and you repeatedly aggravate it, it will come back. So part of those professionals working with you would also be to educate you on how to decrease that tension or how to do different things to modify your posture in order to alleviate that. So that's what tension headaches are, and that's generally the most important thing if you have a new headache is to determine what the headache is, because not all headaches are the same. If you've been able to determine, yes, it is tension and cervicogenic headaches, then that is the best approach. Things like migraines are dealt with in a totally different way. I was actually at a pain conference 2 weeks ago where one of the speakers was presenting on some of the new medication around migraine type headaches. So yeah, I'm not sure if I think that answers your question.
Yeah, I appreciate it. Thank you very much.
Problem.
It actually does.
Thank you.
Thanks very much for calling, Daniel. And you can call, too, here at 416-870-6400, star 640 on your cell phone, pinpointhealth.ca. Info at pinpointhealth.ca is the email address to get a hold of Dr. Lou as well. More of Dr. Lou and your calls on the other side of the break here on Pinpoint Health Show, Global News Radio, 640 Toronto. 11:33 here on Global News Radio, 640 Toronto. Pinpoint Health is the show. Dr. Lou is the man who you're trying to get a hold of right now by calling 416-870-6400, star 640 on your cell phone with a question for Dr. Lou. You can always visit his webpage, pinpointhealth.ca, or send him an email, info at pinpointhealth.ca. Dr. Lou, I'm going to take this moment for a second to deal with something selfish, deal with a problem
that's perfect.
I've been having the last time I did your
It's bad luck when you do my show.
Seriously, or it's good luck because I get to talk to you about it and solve some problems, but I was dealing with some kind of problem. The doctor said it was a disc issue. It was a pain that I had, a sciatic pain that was going down my left leg into my foot. It slowed me down. I couldn't be as active, so I was gaining weight. I was grumpy. I was just a pain to everyone to be around.
Right.
But, I went in, got physio, said it was probably a disc issue.
Right.
And then I got an MRI, went into the hospital in the middle of the night, lay
that
there
bad,
for a
eh?
while
Wow.
and
Yeah.
got it all done. And it was it turned out that there's nothing wrong with my disc. Now,
Right.
my wife, who's a yoga teacher, kept telling me pure formis. Like pure performance. I've got a performance problem on top of everything, honey. What are you telling me? But then I started doing some stretches and stuff, and I got better. But I've aggravated it recently
Again, yeah.
and I'm getting through it.
Right.
But I've still got a little bit of problems with it. So I haven't had a professional diagnosis that is pure
but you've
formis,
had the MRIs and those things. I mean, one of the things that we always look at is there's a thing called diagnosis through treatment. And what that essentially means is, like, if you worked on your piriformis and you got better, you're almost confirming the diagnosis, because if you had done that and it wasn't that, you probably wouldn't have got better. Now, the reality is it could be a combination of things too, right? Like, your muscles do tighten in response to things. The other interesting thing about disc issues, let's call them, is just one simple thing. The way we do MRIs here in North America and in Canada, specifically Ontario, is you're laying down flat. Right. So you don't actually have gravity standing with you. So in Europe, actually, when people have these types of complaints, they actually do them under weight-bearing conditions, because it changes what happens to your disc. So you might very well lay down and whatever would be visible sort of disappears when you're laying down. But then if it's weight-bearing, maybe it's still there. So maybe that's a possibility. The other thing is sometimes you can get not necessarily a disc bulge, but what we call discogenic pain, which is like there's maybe an inflammation of the discs, and that's not overly always visible on MRI, and that can sometimes put pressure on it. The other thing is even just mechanical low back. So if you had something going wrong with the stability of your back just due to weakness, other bigger muscles like the piriformis and those other things will tighten in response, and that will put pressure on it. But you do bring up an interesting thing, and I was mentioning to you, I saw a research article that looked at people that had this type of sciatic presentation. And again, you're right. Most oftentimes, most healthcare professionals that hear that symptom, you're thinking a disc, because that's potentially one of the worst things that it could be, with the exception of even worse things like tumors and things like that. But that's very, very rare. I forget how big the population was that they were looking at, but what they were looking at was essentially they were doing imaging of the disc, and they were also doing imaging of the piriformis muscle. And they wanted to see, is there a way to identify which one of these two things it could be? In all of the people that were there, it was something like less than 1% actually had a disc problem. But in 26 or 27% of the people that they were surveying, or that they were looking at, they actually could find observable problems with the piriformis. And that's interesting because there's probably a lot of non-observable problems that we can't see on MRI, just like tightness due to just overworking it, sitting for long periods of times, because the piriformis is an external rotator of the hip. So it's sort of hard to describe, but it's in your butt, essentially, deep in the glute, deep to the glute muscles. And the reason it covers over what's called the sciatic notch, which is essentially a little hole or an area for the sciatic nerve to come through the acetabulum, which is part of the hip bone. And it covers over that part. Now, in like 33% of the population, the nerve actually pierces the piriformis muscle. So it travels into the leg by going through the piriformis muscle. In most people, it goes under it. But regardless, so if you have a tight muscle or you sit a lot because that's, you put pressure on those things, that can actually create those types of symptoms. So it's a very interesting thing. It's not very well understood by general practitioners, in all honesty. I was at a group of family doctors in a family doctor's office about 3 weeks ago, and I'm going back in a few weeks to do a continuing education session on low back pain, because as I was speaking to them, they were just like, we don't even understand the full extent of that. And they don't have to. They're general practitioners, which means they have to know a little bit about a lot of different things, and then they send it to the right people. But it was very nice to see that they were keen to learn and understand more, and realize that, a lot of times what you're telling people is a disc problem is probably just a muscular problem. And again, going back to those muscular problems, will likely respond very well to those manual physical interventions like chiropractic, massage therapy, physiotherapy, osteopathy, etc.
How important is that sort of the manual therapy?
I think it should be the first line of defense. So for a number of reasons. Number one, when we look at one of the reasons we have an opiate epidemic is because that was the first line of defense.
Right. Just prescribe.
Yeah, and you're prescribing something very, very aggressive. Now, I'm not saying that there's not a place for that. You know my stance. There's a place for everything. But as a first line of defense, my view is that physical mechanical problems need a physical mechanical intervention first and foremost. These people, like physiotherapists, chiropractors, are much better equipped than most general practitioners to assess these problems anyways, in terms of how much time in schooling they focus on this. This is their bread and butter, and where it's not the bread and butter of a general practitioner. So just from an assessment perspective, you're going to get a much thorough and depth assessment most of the time. Now, I also know bad physios, bad chiros. I know bad family doctors. I also know very good of each, right? So a lot of it is also the professional that you're dealing with. But in general, I would say that should be the first line of defense. And then when that stuff is not working, there's so much research around wasted imaging, right? Like, person goes to see a family doctor, low back pain, MRI's ordered right away. Right. That is not the algorithm. That is not the algorithm. You have to do other things. You only really should be ordering imaging immediately if you identify red flags, right? Where there's something where you're saying, there's something more here. Red flags mean imaging should happen right away. So first line of defense should be this type of stuff.
And I guess the problem with wasted imaging too is then you've got long lineups.
Well, let's talk about
people.
Let's talk about the money aspect of that after the break, because that's huge.
Terrific. Time is 11:40, and we're going to take a quick break and come back here with PinPoint Health and Dr. Lou. PinPointHealth.ca, info@PinPointHealth.ca, 1-855-55 Dr. Lou. That's 1-855-55 Dr. Lou. More of the PinPoint Health Show on the other side of the break on Global News Radio 640 Toronto. The time is 11:45. You are here with Chris Creston and Dr. Lou. I'm filling in for John Scholes, who is not able to do the show here today, but I hope that I'm keeping the show on the rails.
Yeah, for sure.
Dr. Lou is the guy that you can get a hold of by calling 416-870-6400 *640 on your cell phone with your questions. I was just bugging him with my questions.
No, it's not a bother.
Here. And we got into talking a little bit about imaging and people who are being prescribed imaging right away. And one of the questions that I had was, I had to go do my imaging at 1:30 in the morning. I was the only person in the hospital except for a security guard and the lady who's running the machine. Yeah. And that's got to be a symptom of that, right? There's not enough machines for all the people being prescribed imaging.
Yeah, there's not. And I mean, MRI is such a great imaging tool. It's used for so many different things they run these things 24 hours a day. And so they have to, because otherwise you'd never get, and I'm sure it still took you, how long was the wait before you were?
I think it was still a couple of months.
Yeah,
before.
You still waited a couple months and you were booked at 1 in the morning or something like that. So it's crazy. So there's a huge burden. These things are also not cheap. Like machines, it's not cheap because the machines aren't cheap. The maintenance of the machine isn't cheap. Then there has to be a technician working I mean, you're working at 1:30 in the morning. You're not working for...
And you're a professional who's got a specific skill. You're demanding a certain salary.
Then you've got the radiologist that has to provide the report. So there's a lot of money that goes into that. And that's why there's a big push in politics for healthcare to look at the evidence on this stuff, right? And see, can we reduce these things? And even something as simple as once upon a time, it was let's take a more simple and cheaper, but still an expense, x-rays for low back pain, right? X-rays, at the very least, MRIs can show us things with the soft tissue and stuff that we can't see on X-ray. X-ray is very good for just looking at the bones. So if we think there's a fracture, right? So the example is if someone comes in to see me and they've got low back pain that just started yesterday, they weren't really doing much, they've had a history of some low-level back pain, but all of a sudden it's really bad. There's no red flags. Red flags are things like there's no excruciating night pain, there's no night sweats, there's no significant weight loss. There's a whole list of things that we would go through. The first line of defense should be treating that person. If in 6 weeks it doesn't get better, because the natural history of these types of things, depending on age and a whole lot of other factors, is let's call it around 12 to 14 weeks. So meaning if a young, healthy person such as yourself, okay, you experienced the pain you were experiencing. If you did nothing, the research would suggest that within 12 to 14 weeks, you symptomatically you'll feel better. That doesn't mean that you don't have a problem. It just means symptomatically you'll feel better. the whole point of this is, can we expedite that? Because 14 weeks is a lot of time out of your life.
Yeah.
So that's what therapy and these things are designed for. Like, can we essentially do that 14 weeks, and can we get you better in 3 weeks? And that's great. That makes everybody happy. It also targets the advantage of therapy is it targets the root of the problem, which natural history usually doesn't. So that's one advantage. But versus if you come in all of a sudden and your story is much different, where you're saying, I was actually up on a ladder and I fell 4 feet. And as I fell, then I was stuck, and now I've got all this bruising. Well, you need imaging in that case, right? Do you see that? Right. That's the difference where we should be doing that. But so low back pain, we deal with a lot of family doctors' offices. And I was also meeting with another group this week on Tuesday. And out of 100 patients that they see in a day, we asked the question, we said, how many of those patients would you say have what we call MSK, musculoskeletal problems, so pain, injury, whatever? And they said probably 60%. Wow. Of the people going in to a family practice or to a walk-in clinic. In this particular instance, they said about 60%. My next question, because I know the research, was how much of that is just low back pain? And they said, probably out of that 50 or 60%, like 80% of that. That's how big low back pain is. It's the second, from an economic standpoint, it's the second most cumbersome thing on economics, next to the common cold. Wow, right? Really? That's how much of an impact it has on economics in terms of people losing time off of work because it's just a weak point. And the other thing about low back pain is it doesn't discriminate. It doesn't matter what, like, low back pain is as prevalent in the poorest areas in Africa as it is here with me and you sitting here today. It's across cultures, male and females both experience it. It doesn't matter. It's just a weak point of being human. And so because it's a weak point, it has this tremendous burden. And because of how many there are, we need to find best practices in order to figure out how do we deal with this the right way and not put this heavy strain on the system, because all that stuff adds up. That's a lot of money. And again, we have this assumption that healthcare is free, but it's not free. We do pay taxes.
Paying a lot for it.
Yeah, we pay a lot in our taxes in order to get that. So we do have to find better ways to treat that. And I think that's what me and my team at PinPoint Health are trying to do is really work with the evidence and do the best thing for treating these things the right way.
To get a hold of Dr. Lou live on the air, 416-870-6400, star 640 on your cell phone. To get a hold of Dr. Lou and PinPoint Health, pinpointhealth.ca is the website. info@pinpointhealth.ca is his email address. We'll be back with more of Dr. Lou and PinPoint Health on Global News Radio, 640 Toronto. 11:54 on your Saturday morning. Thank you so much for making us a part of your day. This is the PinPoint Health Show, pinpointhealth.ca, info@pinpointhealth.ca. 1-855-55 Dr. Lou, 1-855-55-DRLOU to get a hold of the good doctor. Now, we started off the show, Doctor.
Yeah.
You were talking about your independent medical assessment.
Right, yeah.
And how important that is as a way of making sure you had an impartial, independent, professional opinion in the case of someone who's had an accident.
Yeah. And I mean, again, my objective being on the air here is to really help people as much as I possibly can. And this is a big thing that we deal with. And over the last 3 years of doing the show, we've had this business the whole time, or this division of the business, but I've never really talked about it. And I was out for dinner yesterday with a couple colleagues that I work with in this industry, and it sort of just came to my mind. It's like, people should be aware that they can do that. And again, on the insurance side, you don't have a choice. But most of the people listening to the show are going against the insurance. But on your side, with your lawyer, you can have a say on who you want doing these types of assessments for you, because quality of assessor matters so much for this. And again, this isn't me being the assessor in these. I don't actually personally do them. I always make sure that we are finding the very best. And again, the people that we're dealing with are some of the most reputable physicians in the country, in their particular specialties.
And you were mentioning these are people who are working day in, day out in the field, and they're not just sitting behind a desk doing assessments for lawyers and stuff.
No, exactly. And that's why the lawyers and the insurers that do use us because they want truly, and 3 or 4 years ago, this was very different. There were, in this world, there were people that were known as defense hacks or plaintiff hacks, which essentially meant physicians only working on one side, right? And there's been a couple things that have happened, and now it's become a big thing where judges and juries and lawyers and cross-examining lawyers are really starting to say, well, hang on a sec. We really need, again, a certain person, and that person needs to be someone, number one, that is in practice, actually doing that. Like, how can you potentially be an expert and give an expert opinion on a type of surgery if you haven't performed that surgery in 20 years?
If anything, like anything, you're going to get rusty. Right?
Yeah, exactly.
You're going to be behind the times on
there's so much evolution,
and
all these things. But if you're actually in the trenches doing this work and seeing it every day how it works, that gives you a much better standpoint. So we make sure that these assessors, the vast majority of their practice is private practice in some way. The other thing we do is we make sure that they're doing both types of assessments. This is very important. You don't want someone who's just doing one or the other, because you do truly want an impartial assessment. And I know someone listening, saying if they're working with a lawyer, they're like, yeah, but I don't want someone who works with both sides, because you do want that. Trust me, you want that in court. You want someone that the judge can say, no, this person has no inherent bias. Mm-hmm. That's going to stand up much better. You can get a favorable report by someone who only works on one side, but that's going to be quickly thrown out. It'll be ripped apart by any good cross-examining lawyer that understands this and says, no, this is a joke. All you do is this type of work.
Mm-hmm.
So
You've always found this.
It's to your advantage to want to have a say. And again, because the relationship side on the plaintiff side with the personal injury lawyers is very, very different. You can have a conversation as the person with your lawyer. And I'm willing to have that conversation with you and your lawyer. We can have a conference call. We can talk about these things. We can go through the roster of professionals and see if there's an advantage to you. And again, if it ends up being that, no, you don't go, fine. I'm simply putting this out there as another service. If someone's going through something like this, then this is another service that we can help you with because this is part of healthcare. This is what we do.
And so if you're a lawyer or you're someone who is looking to get in touch,
anybody, if you've been hurt in a car accident, and even if you're in the middle of it, just call me to have a conversation. Let's just talk a little bit more about that.
Perfect. 1-855-55 Lou is the number to call. That's 1-855-55-DRLOU. info@pinpointhealth.ca, and pinpointhealth.ca are all the ways to get a hold of Dr. Lou. This show has flown by.
Yes.
Thank you so much.
Thank you, Chris.
Hugely informative for me, and I hope it has been, I'm sure it has been for all the listeners as well. Have a great rest of your weekend, Dr. Lou, and stay tuned to Global News Radio, 640 Toronto.